welcome to my show. Today I'm here with Dr. C. He's going to help us learn about the coronavirus. He went to Harvard Medical School and over 50 years experience. Thank you so much, Dr. C, for being here.
Okay, been a pleasure.
So, Dr. C, what exactly is the coronavirus?
What is a virus, first of all? We need to know what a virus is. A virus is not a living organism. It only lives inside another person's cell. And so it can't reproduce unless it's inside another cell. So it invades. That's what it is. Tiny little thing. So the coronavirus looks like a crown. It has little things coming off of it. Coronavirus has been around for many centuries now. Causes a lot of colds, causes a lot of other symptoms, usually in animals or birds. But occasionally it changes, and then that virus can get into humans as well. So the coronavirus that's coming around right now, COVID-19,
Where did the coronavirus came from?
that started in Wuhan, China. Probably started at one of the little markets there, on one of the markets. They call it a fish market, but they have everything that they sell there, even animals besides fish. So you don't know where that virus was before it changed and then got into humans. We don't know. But at any rate, it started back in December of last year in China. And so what happened is that China kind of kept to itself for about the first couple of weeks, didn't get out, and then all of a sudden, bang, at the end of December of last year, it began to become worldwide. Now it's into over 150 different countries, this virus, and it infects many people. Now we're over 200,000 people who have been infected by this thing. A lot of people.
Dr. C, what is the signs and symptoms of the coronavirus?
A sore throat, maybe a runny nose, could be still just a cold, could be the flu starting, or it could be coronavirus starting. You don't know. They're all about the same when they first start. If I just had a little sniffle or something and I cough next to you, you could possibly get it. Because we're within 6 feet. Remember, when you cough, when you sneeze, that stuff can go out about 6 feet. Actually about 5 feet, but we say 6 just to be safe. 6 feet.
So should we start to panic?
Are you panicking already?
No.
I think a lot of people are, though.
Yeah.
And the reason for it is the way it's being presented to the public. You notice every day, the president's task force is on TV, then comes the governor, then comes the mayor of Boston, and they all maybe say things a little differently. And so the people get very confused. They always start out with the number of people who now have the disease and how many have died. They always emphasize that. And every day, of course, it goes up because now they're testing for it. So every day it goes up. But people shouldn't panic. They really shouldn't.
So I've seen people stocking up their house with food, water, and hand sanitizer and all that good stuff, right?
And toilet paper.
Well, that's the reason.
Toilet paper.
I don't understand why people stock up their house with toilet paper. I've even seen people fighting over toilet paper.
I know. There are people who come out with basket loads of this stuff.
Yeah.
Well, why? Why does that sort of thing happen, huh? Well, like I said before, people feel powerless. They feel that they have no control whatsoever over this disease, and they don't really. And so they try to get some kind of control because they're scared. They're afraid. The only thing they can have control over is to try to maybe buy up some of this stuff to protect themselves from getting it. That gives them a little feeling of control. They really don't have that much other than what they can do to control it. That's it. So that gives them that feeling that they can control it. Now, do they have to buy as much as they do? No, that's crazy. It's crazy because for several reasons. Number one, nobody else can buy it.
Yeah.
And so somebody else may get the disease. And number two, the people who are taking care of people, they call them the caregivers, the hospital personnel and all, they can't get the supplies then themselves. And they're the ones that we really are worried about, because when the people get the disease, the bad disease, they don't have the supplies to treat them with. And so the people who are hoarding the stuff like that, they're really doing a big disservice to all the other people around them.
What should I do if I start feeling sick?
If you start feeling sick, like if you have a little fever, by any of the hospitals, they have these big tents now that they've put up. And inside that tent, they have some nurse practitioners. And what they will do is just ask you a couple of questions, and if you have symptoms, they're going to test you. The test itself, what they do, they take a little, you know what a Q-tip is? Q-tip? No. It's just a little cotton at the end of a little piece of either wood or whatever. So it's a little piece of cotton. And they go in to the back of the nose, in the back. They don't go up, they go straight in, and they take a swab, just a little sample of that stuff, and they put that into a test tube. That test will tell them if there's an RNA virus in that stuff they got on that swab. If it's positive, you have coronavirus. And then you have to self-quarantine. You know what that means, self-quarantine? That means you're going to stay at home. Just like being out of school. But it's not a snow day, right? Not a snow day.
Yeah.
You got to be out for 2 weeks. All the towels that you use, the clothes that you use, the linens on your bed need to be washed separate from everybody else's. The state of Massachusetts fortunately issued some nice regulations on self-quarantine. I gotta hand it to the state of Massachusetts. They really have a very good director of the DPH. They got out all the regulations for self-quarantine and self-isolation. So that is a good thing.
So should we start to wear a mask?
Oh, the masks. Have you ever worn a mask?
Yeah.
Have you? Good. There are 4 types of masks, 4 that are out there. The first type of mask is a very thin mask. And we use it for people who they say are in, quotes, isolation. We use it in the hospitals. You see it out on the street, they have a little thin mask over their face. That does no good whatsoever. Doesn't protect them, nor does it protect the people around them. Then there's called a surgical mask. Surgical mask. That's the kind that I used to wear because I'm a surgeon. That works pretty well because there's 3 layers to it. Not just 1 layer like that first type, 3 layers to it. So it does keep a lot of the virus and the bacteria out of your body. But what it does is that it protects others if you happen to have the virus, because the virus can't get out. Doesn't protect you from getting the virus in. Then there's the mask called N95. Now, what does that 95 stand for? Keeps out 95% of the bacteria and viruses that are out there, but it has to be fitted. So if you have a beard, you can't fit it properly because the virus can still get in along the beard. The fourth type of mask has 5 layers in it, and it has a carbon filter in it. That keeps out 99% of all the bacteria and viruses. Those should only be worn by the healthcare professionals who are taking care, the doctors and nurses who take care of the people at the hospitals. The N95 should only be worn by somebody who's taking care of a sick patient with COVID-19. Only the ones taking care of them. Okay? The surgical mask should only be worn by people who have the disease, the COVID disease, because then at least they're not going to spread it. Otherwise, no reason to wear a mask. So if you have no symptoms, I wouldn't wear a mask.
So is the coronavirus dangerous to children?
Is it dangerous to kids? Well, I think just yesterday they came out with in China, they have the biggest experience because that's where it started, that's where the most of the cases were from there. So they reported on 2,300 kids who got the disease. And the kids who got the disease, fortunately, got it very, very mild or no symptoms, fortunately. But some kids, unfortunately, didn't do so well either. They usually are the kids who had other diseases like diabetes or some other disease that affected their system. So they didn't have any resistance. So what happened with them is a lot of them got another bug, like a bacteria or another virus coming in and infected them. And so that's the reason that they got put in a hospital. Fortunately, too, the kids didn't have a large number of them dying. Thank God, right? Good thing for the kids.
How can I protect myself from the coronavirus?
Okay. So what can we do? First, there's stuff we can do as an individual. How can we help ourselves to try to prevent it? Well, number one, you try to avoid people who have symptoms. Now, you don't know when you see somebody if they have a cold, if they have the flu. You don't know because the symptoms are the same. Number two, hand washing. Hand washing. Now, we should be doing hand washing because of the flu anyway. You don't use a bar of soap. What you do is you use liquid soap. Why? Because once you use that bar of soap, if your hands have the virus on it, now that virus is on the bar of soap. And so if somebody else comes to use the bar of soap, they're going to get it on their hands, aren't they? Wipe. First of all, get it in your palms. Second, you get it all in between your fingers too. All those areas in between the fingers. You've got to make sure you wash that as well. Next, you want to get your nails. Very important, get your nails. So you scrub those as well. And then finally, you get the back of the hand all the way up to the wrist. All the way up to the wrist. That should take you a good 20 seconds. Rinse it off, and then how do you dry it? You dry it with paper, not with a cloth. So you use the paper towels and dry it off. Use that paper towel then to turn the water off, and then use your paper towel to get out of the bathroom or wherever you are. You don't want to touch the knob, right? Well, you should probably avoid anything over 25 people together. There's some people now say, well, you should avoid anything that's 10 people or more. And so the community can do something to help too. The community can say, we don't want anybody getting together more than 25 people, period. That happened in all the churches now. You can't have a mass now because there's more than 25 people. Can't have it. The restaurants have closed. Only get takeout, only. And that's over 25 people. all of the big events, like the sporting events, all of the, like hockey, and baseball, and basketball, they cancel their seasons now. As also part of the community thing as well. For example, I ran this clinic. It was a free health clinic here at St. Anne's. I ran that for 20 years until I retired. And now someone else is running it. Well, there's over 25 people there that had to get closed. Had to be closed. Don't know for how long, because we don't know how long the virus is going to be around. We don't know that yet. So what do you do? How do you clean that? Well, we disinfect it. What do you use for disinfection? Bleach.
If somebody is like at home and they're sick, do they need to wear gloves?
Well, the gloves, you don't need to wear gloves yourself. But if somebody else is in that house with you who don't have the virus, anything that you have touched, they should wear gloves and not touch it with their hands. Now, maybe you'll be negative. We don't know that though until the test comes back. So they will have to wear gloves.
So I know this is a silly question, but we need to know everything about this virus. So can pets get the coronavirus?
We're not 100% sure. It doesn't look like the pets will get it. But remember, viruses change. And just like we got it probably from some animal in Wuhan, China, that could change too.
So money comes from all over the world, right? Especially the dollar. Is it possible that people can get the coronavirus from handling cash?
Yes, money is very, I would be very afraid of handling those dollar bills. Now, handling coins is different. The virus will only last maybe for, 4 to 6 hours on a coin. But on paper, the dollar bills, all those, not just dollar bills, $100 bills, all those bills, they can live for a couple of days.
So can we learn more about the coronavirus? Like, is there a website?
The only website that I would use myself would be the CDC website. Now they put that on every day, and it changes. Sometimes several times a day they'll have announcements that they make. But the CDC, only one that I would trust.
Thank you so much, Dr. C.
Hey, been nice being here.
Thank you so much for helping me learn more about the coronavirus, but not just me, our community, right guys?
That's it, the whole community, because we got to work together. We're going to defeat it eventually.
Yeah. I hope we could help you learn more about the coronavirus. Please share this video to your friends, to your family, and wash your hands and stay healthy. Thank you so much. Bye.